When you replace someone's hip or knee, their relief and the function that they gain is almost immediate. So you have someone who comes in with hip or knee arthritis and you give them a hip or knee replacement, and the next day they're up and walking with therapy, and they're so thankful, and there's nothing better than seeing someone happy that they can start to do the things that they haven't been able to do for a long period of time. So for hips in particular, I try and use a minimally invasive, either anterior approach or alternatively what's sometimes referred to as a superior approach, but both are considered minimally invasive approaches. To me, Loyola is a very special place, and wanted to come back and work here after my training. All of the physicians here, particularly within the orthopedic department, are top-level providers in terms of the care they provide, providing cutting-edge technologies, cutting-edge treatments for very complex problems. Patients and their families hopefully truly can recognize that we're not just treating a hip or a knee that's in pain, but we're trying to take care of that person to get them back to what they want to do with their lives.